my name is Amy Chamberlin. My practicum journey began with a partnership between Hendricks Regional Health and DePauw University. The purpose of the practicum was to gain a real-world experience in the area of public health among the faculty, staff, and the students at DePauw University. The concentration of the practicum was centered on health promotion and disease prevention. DePauw University has set the goal of achieving a position on the annual honor roll of healthiest colleges in the United States, as published by Greatest.com. Employers have been forced to make choices such as decreasing overall benefits, reducing the number of full-time employees to decrease an insured workforce, or increasing the portion of employee contributions. Beginning on August 4th, 2015, Hendricks Regional Health opened its first wellness clinic for faculty and staff. While the overall project is multidisciplinary in nature, the Wellness and Population Health Department was specifically tasked with creating innovative wellness programming for these specific populations to meet their unique needs, with the hopes that barriers will be removed and wellness opportunities for healthy lifestyle change will flourish. As stated from the Centers for Disease Control, health is a dynamic state of complete physical, mental, spiritual, and social well-being, and not merely the absence of disease or infirmity. This definition of health takes the whole community to identify and solve health problems. In combination with the Hendricks Regional Health and the workforce at DePauw University, I was provided with the opportunity to network with others. The ability to affect change and build capacity for both a healthy campus and the community surrounding DePauw University is exciting. This challenge is especially welcome as it will become a part of my job responsibilities in the future. As defined by the Institute of Medicine, the determinants of health are beyond the capacity of any one practitioner or discipline to manage. We must all collaborate to survive as disciplines and as professionals attempting to help our communities and each other. Slide 2. DePauw University has stated goal to rank among the top 10 for the healthiest college campuses. At Hendricks Regional Health, the Wellness and Population Health Department has been tasked to create innovative wellness programming opportunities for students, staff, and faculty. In order to achieve this goal, barriers must be removed for increased access to health care. Additionally, affordable healthcare options and wellness opportunities for healthy lifestyle change must be provided. The goal is to provide well-designed programming that leads to better access to care that ultimately leads to reduced healthcare expenses and a healthier university employee population. The design of the practicum was based on 3 objectives. The first 2 objectives were met in its entirety, while the third will be remaining ongoing. Throughout the 16-week period of the practicum, much has been done to assist DePauw University on its journey to become the healthiest campus. The 3 objectives are as follows. Objective 1. By August 30th, 2015, wellness initiatives will be carried out for the student population, specifically student athletes and student musicians, through health screenings which include height, weight, BMI, and blood pressure, by 100% participation at DePauw University. This objective is based on the Healthy People 2020 under nutrition and weight status, which sets out to increase the proportion of primary care physicians who regularly assess body mass index in their adult patients. Through these scheduled screenings, HRH wellness staff will provide a baseline for the student population who can then set personal goals for wellness. Objective 2. By the end of the 16-week internship, a chronic disease management program will be launched using the health and wellness coaching model with specific emphasis on the behavioral aspects of obesity, hypertension, and medication compliance for the faculty staff at DePauw University. This objective is based on the Healthy People 2020 goal of improving access to quality healthcare services, which states increase the proportion of insured persons with coverage for clinical preventative services. Faculty and staff now have access to the health clinic as well as health and wellness coaching. Objective 3. Beginning January 2016, a campus-wide health education campaign will be launched for students at DePauw University, geared towards student-specific health issues such as vaccinations, alcohol abuse, sexual health, and stress management. Finally, this objective is based on the Healthy People 2020 stated goal of increased quality, availability, and effectiveness of educational and community-based programs which are designed to prevent injury, improve health, and enhance quality of life. Through the development of this health education campaign, students will receive timely education to help guide their health choices during their experience. Slide 3. The activities outlined in this practicum include coordinating with clinic staff for a successful clinic opening for faculty staff, initiating a health risk assessment for faculty staff, promote and run a flu clinic, provide health and wellness coaching, and develop a targeted disease program for hypertension, type 2 diabetes, and obesity. My activities included assisting the clinic staff with the opening of the healthcare clinic, providing physicals to the student athletes and School of Music students in combination with the physical therapy department, design and implementing a chronic disease management program, help provide an influenza clinic, and begin providing health and wellness coaching to faculty, staff, and students. Slide 4. During the practicum, I was able to accomplish the following: assist in 757 health screenings for student athletes and musicians. MetaKeeper, which is an online health assessment software used to identify personal health risk factors, was rolled out to the faculty, staff, and students. To date, 220 participants, or 33.95%, are effectively using the tool. By setting personalized goals to improve overall health and well-being, the power of everyday behaviors and healthy choices is emphasized. A total of 812 influenza vaccinations were provided to faculty, staff, and their dependents and students. A targeted chronic disease management program was developed to address obesity, hypertension, and type 2 diabetes, to be used in conjunction with health and wellness coaching. The purpose of the program is to ensure that DePauw University faculty and staff diagnosed or suffering from these chronic conditions will get the help that they need in managing their complex health conditions. Upon completion of the program, it was rolled out to health and wellness coaching participants. To date, I have met with 13 coaching clients. And finally, I had the privilege to present a women's health talk for Delta Sigma Sorority, Inc. at their Fall Dine-In Discourse, in which I prepared 28 slides. I was given a 30-minute time slot to present, but ended up talking for over 40 minutes as the girls had many interesting questions. Slide 5. To date, I have logged over 128 hours at DePauw University. Many networking opportunities have been afforded to me through this practicum experience. I've been able to work with the following groups and disciplines in the course of my time at DePauw University. Executive Committee, which consisted of hospital directors and university administrators. The Steering Committee, which included the Wellness Director at Hendrix, the Occupational Medicine Director, VP of Student Life, and Athletic Director, and, of course, the Marketing Manager. And, finally, multidisciplinary medical staff, which included clinic physicians, physical therapists, speech pathologists, and clinic nursing staff. Networking builds the capacity to link to other essential elements of public health while providing future partnerships with a variety of sectors. I am indebted to this practicum for the experience and networking to inform, educate, and empower people to make healthy choices. Slide 6. I am fortunate that I do not have to turn this project over to someone else to carry out. This will become a part of my responsibilities as the Manager of Wellness and Population Health at Hendrix Regional Health. I have recommended to my preceptor that I need to spend more time getting to know the faculty staff at DePauw University in small groups so that they can become aware of the wellness initiatives that are now available to them. I would also like to spend more time in front of student groups sharing information surrounding health and wellness topics. I am excited for what the future holds for Hendrix Regional Health and DePauw University. We have just begun to scratch the surface in helping them become one of the healthiest campuses in the United States. Slide 7. This is not the end. It is just the beginning. Thank you for your time.